So some of you may have seen Anderson Cooper as he discovered mindfulness meditation, and it's something that's been of interest to me over the years. And we're fortunate to have with us today Dr. Paula Ravets, who is a clinical psychologist. She's affiliated with UCLA, and Josh just mentioned their Integrative Oncology Center. They also have a center called MARC for short. It's the Mindfulness Awareness Research Center, and they offer classes. And I'd like you to please help me in welcoming Dr. Paula Ravets.
Let's see if I need that step.
It's up to you.
How tall are you, Giovanna?
Short.
I'll take one. How tall are you, Josh? I'm going to go right in the middle. Hi, everyone. Thank you so much for having me here today, Giovanna. And I have to tell you that when I walked in and I just stood in the back on the side for a little while, I really felt the warmth here and how much all of you have become a group and a family. And I think that's so important. I don't have a screen to show you. I'd love to put back the zebra or the sandwich, but imagine that in your mind for a moment. When Giovanna asked me to be here, I thought, what would be the most useful thing to say to you, because there are so many areas of mindfulness to talk about. First, let me ask you, how many of you, maybe by a show of hands, have heard of mindful awareness practices, MAPS? Wow. Fantastic. And how many of you currently have some sort of practice, maybe not a sitting practice, or maybe yoga or Tai Chi or singing or painting? Lots of people have practices that bring them into the present moment. Okay, some. Maybe we need a few more. So in thinking about this talk, what I really thought about was the idea of a marathon rather than a sprint. And how when you have a marathon of a chronic illness, what you need to have is some kind of resilience. And maybe some of the speakers have spoken about that already today. A resilience and also a certain level of equanimity. So equanimity to face the uncertainty. And these are things that a mindfulness practice can bring when we're faced with maybe an atypical type of struggle or challenge. Let me define it for you, I'll let John Kabat-Zinn define mindfulness for you. He says that mindfulness is paying attention in a particular way, paying attention just to the present moment on purpose, without judgment. And without judgment is a big one. I like to add with curiosity. Can we bring the curiosity of a child to everything that comes in front of us? Can we pay attention to our bodies and to our emotions and to our environment on purpose? Here's something. So with practice, perhaps we can learn to step away from unconscious reactions to psychological stressors and physical stressors. Meditation is thought of as coming from the East, but in the last 30 years or more, these widely recognized practices of meditation have been researched and developed in the West. It's this research that's accelerated the use of mindfulness in medical circles. So what does the research show? I had a whole big thing planned to tell you, but I think I'm just going to give you a slight overview since I think we're going long. But I'll just tell you maybe one or two studies that are, I think, relevant to us. There was a seminal study by John Kabat-Zinn in 2003, and the reason I like to point this study out is because it was a study that only took place over 8 weeks. So he took 2 groups of people, and he trained one group for 8 weeks using MBSR, mindful-based stress reduction techniques. And then he had a control group. And after the 8 weeks of meditation, he inoculated both of these groups with the influenza virus. And then he did an MRI on both groups, and what he found was that the people who had been practicing meditation for only 8 weeks had much stronger antibody titers and much stronger lighting up in the region, the left anterior region of the brain. This is the area of the brain that's associated with positive emotions. So what does this suggest? This suggests that just a tiny bit, if you think relatively, a tiny bit, 8 weeks of meditation can improve our brain processes and our immune functions. Pretty important when we're dealing with stress and other factors of chronic illness. So maybe even there's a faster recovery for us when there's a negative provocation, whatever that might be, whether that's emotional or physical. A lot of research has also been done on things like hypertension, anxiety, depression, and pain. Richie Davidson did a study on pain, similar, 8-week study only, 8 weeks of training, beginning meditators. And what their group found was that in meditators, their sensation of pain while meditating went down 40%. Pretty significant result. So there are more studies, but I won't tell you that because I want to make sure I have time to give you a practice to experience today. Would that be okay with everybody? Good. Okay. So it's great news. You don't have to be a Zen master. You don't have to study meditation for 10 years. You can start studying today. Actually, this experience right now, today, that we're going to do will count as your beginning study if you haven't already started. I think that meditation is a very accessible tool. It's something that you don't even have to have a pocket for. It lands right in your mind. It's an accessible tool to deal with suffering. What do I mean by suffering? We've all had it, right? And there are different types of suffering. So maybe we want to distinguish between what we call primary suffering and secondary suffering. Primary suffering is any kind of unpleasant physical sensation that's brought on by illness or by injury or even by fatigue. And you may not be able to do anything about that. I think Josh was just talking about that a minute ago, living with an idea, or Giovanna was talking about living with the notion of something that you can't shift. That's primary. Secondary suffering is the suffering that we do as humans with the anguish of our reaction to the primary suffering. And that's, I think, what is touched by mindfulness practice. We can touch those feelings of anger, of fear, of anxiety, and we can reduce the reactivity so that we can improve our quality of life, even if the primary suffering remains the same. So some other questions that I considered when thinking about what to share with all of you were, how can mindfulness help just in the beginning with diagnosis? How can it help during treatment? What role can it play with dealing with difficult emotions? And what function can it even play for caregivers? Are there caregivers here today as well? Great. Oh, that's so good to see. Okay. So in the early phase, after someone's diagnosed with a serious illness, there can be a lot of uncertainty. We've talked about that already. And the uncertainty can have a trajectory that goes through treatment and through palliative care even. But at the beginning, there are so many questions that come to mind that it's not uncommon for people to start spinning a story. Has anyone done that? You spin a story without knowing the end of the story, and you spin a story that leads to a sense of overwhelm and anxiety. So I think mindfulness and the focus of mindfulness is bringing us back to the moment of what's happening right now only. And that does take a lot of practice. We like to go ahead of ourselves and imagine that if we could think it, we could be there. So dealing with the uncertainty rather than jumping into future thinking. And how can mindfulness help during actual treatment? This goes back, I think, to the idea of resilience. We have an ongoing, lengthy process, and we want to be able to be there fully. Maybe sometimes we don't want to be able to be there fully. But I think that when there's more participation from those people that are suffering, there's more of an opportunity to get the most from your treatment. You're not, after all, a machine being taken to the shop just for a repair. So you want to be able to participate as much as possible in your own care. Participation, awareness of your lifestyle, and a present moment awareness of your body and what it's doing. You want to be able to negotiate with your doctor about your treatment options. The more that you can be present, I think, the more agency you can have in any possible situation that confronts you. And if that's not enough, perhaps the best part about this is that when you can actively engage, as opposed to being a passive recipient of care, you can have a certain more stable peace of mind. So once again, grounding in the present moment, rather than moving forward with fantasies about what might be, and really increasing your ability to effectively communicate. How many of us bring a friend or a loved one with us when we have a doctor's meeting? Yeah, a lot of people, and it's a really good idea. But imagine being as capable as that friend when you go to the meeting, being so present and so aware of what you need in the moment that you're able to stop the authority and ask questions, stop the authority and say, hey, this is what I'm dealing with right now, and please put aside your agenda. So the idea of being able to be present enough to ask for what you need. How are you feeling? How do we deal with different and difficult emotions? How are you feeling? You don't have to answer me. Just think about it for a minute. Can you answer that right now? Meditation gives us a chance to deal with that question at a much deeper level. With meditation, we have time to sit with the difficult emotions. We have time to tame the raw emotions like fear and sadness, and the emotional states like anxiety and depression. And I think also with certain mindful practices, we can cultivate feelings that balance those more negative states. We can cultivate compassion and kindness for ourselves. I like to think about an inoculation of negative emotions, or maybe a titration, that we don't want to ever force ourselves to be with something that's unbearable, but we want to approach it gently, step by step, so that over time we can sit with it more fully and not become overwhelmed. That's what we talk about when we talk about equanimity, the ability to be with almost anything without reaction, but instead with responding. Depression is a major concern for some patients. To a large degree, though, this is a disease of dysregulated thinking. There's a lot of evidence that mindfulness can help us develop a different relationship with a stream of negative thoughts that might be called depressive rumination. We often relate to our thoughts, whether they're negative or even positive, as if they are a reliable statement of the truth, as if they are a fact. Pema Chodron, if you know her or if you don't, I would highly recommend two of her books right now. One is called Dealing with Uncertainty, and the other is When Things Fall Apart. She talks about learning to train the nervous system, to contain whatever discomfort and uncomfortable feelings there are for longer periods of time, rather than to push them away. Maybe a common training in American society anyway is, oh, if you don't think about it, it's not there, or look the other way. But with a mindfulness practice, what we encourage you to do is to actually look right towards it, step right towards it, and find a way to hold it. So you're living more fully in each moment of your life without judgment. So part of what we do is we learn to not identify with a thought. We learn to note a thought, note a feeling, perhaps something like, oh, there it is, I'm feeling anxious. There it is, I'm feeling frightened. Or there it is, oh, I feel tremendous relief, rather than being caught on a wave or in a storm of emotions. Instead, thinking of them more like passing clouds. There it goes, there's sadness, there's relief. And I remember reading a study a while back that even said any emotion, if you track it, doesn't last more than 20 minutes. So maybe you can think about that the next time you're caught in a wave of something particularly unpleasant. That if you took your clock out at that moment and watched it, it would be kind of neutralized within a short period of time. So what role can mindfulness play and mindful awareness practice play for caregivers? There are so many indications that mindfulness practices can be beneficial for doctors and nurses and caregivers. A study by Kramer and Epstein showed that teaching primary care physicians mindfulness practice reduced their burnout and increased their empathy. Shauna Shapiro did a study with medical students showing that teaching them mindfulness practices also increased their capacity for empathy. And I think that when caregivers are less burnt out and less sick of doing what they're doing, they're also more attentive, and there are fewer errors to be made. I think that perhaps doctors and nurses can also be better diagnosticians when they're not just looking at the agenda or their clipboard, and they're looking at the subtleties of the whole person. So that's what mindfulness is asking you to present. Also, when you're the patient, present your whole person, not just the physical symptom. I can tell you that when I first started at Cedars, I've been teaching a meditation class here for 2.5 years, but I started by teaching by doing a pilot study at the NICU. I wanted to bring the parents of the babies in the NICU a meditation practice and to help them relieve their stress and tremendous uncertainty that they were living with generally about whether their children would survive or not. And what I found is that after about 4 weeks of working with the parents, it was the nurses in the NICU that were asking for their own program. And in fact, the parents got a little bit too busy to keep coming to the program, but the nurses were coming regularly and reporting that it really helped them with the stress on the unit. So I think with chronic illness, it's essential to cultivate a style of life that reduces your stress and increases your sense of well-being, however you do that. Mindfulness is certainly one way. Richie Davidson of the Center for Investigative Healthy Minds, isn't that a great name? The Center for Investigating Healthy Minds. He says that the mind underlies all that is important for flourishing and happiness. So mindfulness is not about fixing what's wrong at all. It's rather about accepting and perhaps rewiring our brains so that we can be in the moment and be with whatever challenges are in front of us. So before we begin the mindfulness exercise that I'm going to give you today, I'd like to just read you a poem, if you'll indulge me. This is a poem by Rumi, and perhaps this is a poem that is the most frequently recited poems in all meditation retreats and all the courses that are given around the world. And I love a lot of his poetry, but this one, I think in particular, gets to the heart of cultivating mindfulness. So I hope that you find it useful as well. And this is called The Guest House. This being human is a guest house. Every morning, a new arrival. A joy, a depression, a meanness, some momentary awareness comes as an unexpected visitor. welcome and entertain them all, even if they are a crowd of sorrows who violently sweep your house empty of its furniture. Still, treat each guest honorably. He may be clearing you out for some new delight. The dark thought, the shame, the malice, meet them at the door laughing and invite them in. Be grateful for whatever comes, because each has been sent as a guide from beyond. So that's Rumi. The idea of meeting anything that shows up. And there are so many ways to cultivate a mindfulness practice. I'm sure you've heard of a lot of them. There's walking meditation. There's sitting meditation. There's creating a gratitude practice. Have any of you heard of that? Good. That's kind of a nice one and an easy one, and one I practice daily. And then there's the practice of loving kindness, or in the Buddhist world, it's called a metta practice. And that's the one I'd like to just briefly share with you today and teach you. Well, I'll give you an abbreviated version of it, and hopefully you'll be able to take it home also and practice. Okay, are you ready? Can you dim the lights a little bit? Maybe? Okay. Enough talking, let's experience something, right? So allow yourself to get as comfortable as you can. I think these chairs are pretty comfortable. Maybe put your feet on the floor and let your arms just fall loosely in your lap. And the purpose of this meditation, this guided meditation, is to really encourage you to experience the warmth of loving kindness. And it's something we'll direct, the traditional practice is directed towards ourselves and towards others, and we'll practice in a certain way with this community here today. So if it's comfortable, you can allow your eyes to close. If it's not comfortable, you can just gaze down at the floor. Just softly so you're not distracted. Whatever feels comfortable, there's no right or wrong. Just allowing yourself for a moment to just get here. Allowing my voice to be in the background softly. And we'll begin by just thinking for a moment of a person or a being for you. It doesn't have to be a person, it could be a pet. Someone, some being that's so easy to love, so easy to care for. Someone that just brings a smile to your face as you think about them. This loved one, this cherished one. And as I say these phrases, just quietly in your mind, repeat them to yourself, thinking and visualizing this person. May you be well. May you be free from pain and suffering. May you be happy. May you be peaceful and at ease. Really letting yourself imagine this being, feeling all of that warmth radiating towards them. And now have an image of yourself in your mind's eye. It doesn't have to be you as you are today if that's difficult. Sometimes it's difficult for people to feel this kindness towards themselves. It could be you as a child, you at a different age, where you felt more lovable. And we'll practice these same phrases of loving kindness. Really envisioning yourself. May I be well. May I be free from pain and suffering. May I be happy. May I be peaceful and at ease. Really taking in that feeling, knowing that you can use these phrases for yourself, directed towards yourself, whenever you feel challenged, whenever you feel unsettled. And we'll do one more. We can modify a little bit. Try to imagine the whole community, the whole group gathered here today. All the people that you've known for a long time, the people that you've just met today, and the people that you'll be meeting in the future because of your common struggle. I imagine them as a group and what you wish for them. May you be well. May you be free from pain and suffering. May you be happy. May you be peaceful and at ease. Just noticing how that feels in your body, in your mind. Even if you're a cynic about these things, or if you feel them easily, just noticing without judgment what this experience is like. And you can open your eyes when you're ready. Thank you for your willingness to do that. It's sometimes hard after a day of listening and talking to jump right into yourself. So I just want to close. There's so much more. I'd like to encourage you to access all the different places that offer mindfulness in Los Angeles, the MARC Center inside LA, so many different teachers around where you can really get support. But the idea of cultivating a mindful lifestyle, being good to yourself, treating yourself with kindness, living your life with awareness in the present moment, getting to know yourself and not letting your illness define you, enjoying the beauty of the things around you just as they are, not as you wish they were. Recognizing and exploring places of healing and peace, maybe spirituality too, and calmness so that you can develop your resilience. Surrounding yourself with people you love, people that support you and inspire you, especially when you're facing a hard time. And finally, letting go of the life that you had planned and accepting whatever opportunities are in front of you now. The hopefulness that's there and the peace that's possible. And finding a time to practice gratitude. Okay. Thank you very much, everyone. Do you want me to ask for questions?